Hi, I'm Dr. Chad Larson. When it comes to fat burning, we really have to have these particular hormones in balance. Fat burning requires the proper balance of lots of hormones in your system, but these ones you have to really get right. In fact, oftentimes when you get these ones right, the other hormones that are involved kind of fall into place. So I wanted to create sort of a table to give you kind of a quick, simple understanding of what these do in your system. So we have the hormone like cortisol, insulin, testosterone, and then we have, is that hormone catabolic or anabolic to muscle and fat? So catabolic means breakdown and anabolic means build up. And these hormones have a really direct influence on how these affect your fat and muscle cells. So like, for example, cortisol is a hormone that in chronic elevated levels, that's kind of the key thing here, is we're talking chronic elevations. These hormones go kind of up and down even just on a daily basis. But if they're chronically elevated, it runs into these problems. So chronic elevation of cortisol is catabolic to muscle, meaning breaking down muscle, and anabolic to fat. High long-term levels of cortisol, we know, increases fat storage and muscle breakdown. Cortisol is a stress hormone. In the COVID era, a lot of people are experiencing a variety of types of stress, and that can influence hormones like your insulin. So just as a quick reminder, your hormones work like a big symphony in the body. They all have to kind of harmonize together. You get one hormone off, that could influence the other hormones, kind of the harmony of the whole symphony, the whole situation with all the hormones in the system. So insulin being the next one. Insulin's kind of interesting. It's not really catabolic to anything. When insulin's in the system, it's a builder. It's a growth signal to your body. It's like the body is saying, okay, we need to turn on growth and storage. And so that's what insulin does. It's anabolic to both fat and muscle. So, I guess that's kind of good for muscle, but that maybe slight benefit we can have from muscle from insulin pales in comparison the bad effects of elevated chronic insulin to our fat cells. Insulin causes fat storage. We've talked about this on many episodes from a variety of angles, and that's basically what it comes down to, is that insulin at high chronic levels causes fat storage. Even at acute levels, if you eat a bunch of food that is high in refined processed carbohydrates or sugar, the body needs to do something with that glucose. Insulin's going to go up, and a lot of that glucose is going to be converted into fat, and it has to be stored in fat cells. But over a chronic time, that's where it could really turn into, life-altering and increasing your risk factor for things like obesity, diabetes, and these kind of things. And then, of course, testosterone is actually the complete opposite of cortisol. It's catabolic to fat and anabolic to muscle. So if we're kind of telling a story about testosterone and cortisol, testosterone being sort of the protagonist of the story, cortisol would be the antagonist. It does the complete opposite. So you can see in times of stress, when stress is up, cortisol is up chronically. I'm seeing this clinically all the time. People are coming in complaining, my muscles just don't feel like they have the integrity that they used to, and I'm getting fat. I'm getting fat mostly around my midsection. I'm hearing this during the COVID era, sort of over and over again. It's a really common situation. So it's important that we get these hormones under control, but you don't really know how to get them under control until you test them. So just a very simple blood test. I test this on every new patient, these hormones. These are just 3 of many hormones that are included in our whole hormone panel. So it's really key to have these tested, take the guesswork out, and then apply the proper mitigation strategies to do things like stress management. And there's lots of different things that we can help to do to control insulin. Diet is really the centerpiece. Testosterone is involved with this whole hormone cascade. So they all work together, but the idea is to first get tested and find out where you're at, and then take the proper mitigation with a proper healthcare provider that really knows what they're doing with hormones. So hopefully you learned something there. Get these things tested, very easy to do, and they can really change your life, especially from a fat burning and muscle support kind of standpoint. So I'll keep reading the studies and bringing you the information. Until then, keep it real.